Today we're discussing osteoporosis with Nurse Jackie Hickey of Bayshore Home Health. So Nurse Jackie, what actually is osteoporosis?
Osteoporosis is a disease of the bones. It affects the bones directly, and what you tend to see is thinning, porous bones over time. And really it's that concept of deterioration. And so it's called the silent thief. There really are no signs and symptoms. It happens to us, it actually starts in our 30s. And what we tend to see is individuals, once they get over the age of 50, they may start to feel some pain and things like that. But most characterized is when an individual falls and fractures their bone and they end up in the hospital, and then they may look further into maybe family history and other things and diagnose them as having osteoporosis.
So if there's actually no signs, what can we do to prevent it from happening?
So prevention is lifestyle. And once you hit a certain age, or maybe you're premenopausal, you might want to start thinking about it more seriously. So what are some of the things that we can do? Calcium-rich foods, really taking a look at our intake, supplements like calcium, like vitamin D. And it's important that we speak to our practitioners, our family doctors. This is always in conjunction. And anytime we want to take something new, some medication, we want to make sure we have that conversation. Right. Because there's different doses for different ages, so it becomes important. Exercise, really looking at physical ability of our body and recognizing that we need to increase the blood flow, increase the oxygen, and increase the nutrients, because the bone is a tissue. So we need to keep it healthy. Other things like avoiding certain types of foods and substances that may deplete the calcium in our body. And these are like your salts, your caffeine. Obviously everything in moderation, but looking at what is going to help you maintain a healthy bone in your body.
So once a person has osteoporosis, how do they manage it?
Managing osteoporosis becomes, as I said earlier too, a lifestyle that we need to adopt. We need to build it into our daily routine. We need to, look at treatment, different types of treatments, build that into, our regular routine. And, look at safety, because again, the key thing with osteoporosis and the bones is potential for fractures.
Right.
So we want to prevent that. So, mobility, using different devices, thinking about what we're doing as we take our step, preventing that fall, looking at maybe hazards that could be around our home, and building it into our lifestyle, because it's with us.
Just being aware. Well, thank you so much. This is great information.
You're welcome.
Now, if you'd like more information about osteoporosis, please visit bayshore.ca. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.